Good morning, everyone. How are you today? It's me, Shane Lee. Had a busy day today. I went to Memorial twice and then Candler once because I was having a little bit of arthritic pain today in my neck, my back, my hands, and my left ankle. This here is proof that I got medication for it as well. They prescribed me some prednisone, some cyclobenzaprine, and some hydrocodone. See? Now, they also gave me return to work school in 2 days. Give me a break. Lee Shane was seen at St. Joseph's Candler Health System Home and may return to work school within 2 days of this visit. Authorized signature title May 23rd, 2017. Not that I'm working there. Alright. Patient visit to the information. You are seen today for acute exacerbation of chronic low back pain. Patient instructions reviewed. ED sciatic, ED spasm back, no trauma. Received 05/23/17 at 16:33 p.m. or military time, or 4:33 p.m. or 16:33 military time. Follow up. Lee Shane has been referred to the following clinic specialties for follow care: Baker Roy P. M.D., 4 Jackson Boulevard, Savannah, Georgia 31405, 912-355-1010, None X. New prescriptions and instructions for this visit. See detailed home medications list for all medications. And it says cyclobenzaprine, HCI, Flexeril, 10 milligrams oral 3 times daily at 0900, 1500, and 2100. That's 9 a.m., 3 p.m., and 9 p.m. again. Number 15 tablet, 10 milligram tablets. That's good for 5 days. 2. Hydrocodone, acetaminophen. 5. 325 milligram Lortab 5. 1 to 2 tablets oral, Q6H as needed, number 10 tabs, 1 tablet, refills 0. 3. Prednisone, Delta Zone, 40 milligrams oral daily, 0900, number of tabs 10, 20 milligram tablets, 0 refills on them all. Additional instruction. The exam and treatment which you received today in the emergency department has administered on an emergency basis and is not intended to be a substitute for complete evaluations in a doctor's office. Follow-up and re-examination by your doctor is essential to complete medical care because it is often impossible to recognize and treat all elements of injury. Instructions for enrolling in the iConnect patient portal with a pen. It goes through how to do that. Instructions for enrolling in iConnect patient portal without a pen. Back spasm, no trauma. Spasm of the back muscles can occur after a sudden forceful twist or bending force, such as a car accident, after a simple awkward movement, or after lifting something heavy with poor body positioning. In any case, muscle spasms add to the pain. Sleeping is in an awkward position or on poor quality mattress can also cause this. Some people respond to emotional stress by tensing the muscles of their back. Pain that continues may need further evaluation or other types of treatment, such as physical therapy. You don't always need x-rays for the initial evaluation of back pain, unless you had a physical injury, such as from a car accident or fall, which I've had both. If your pain continues and does not respond to medical treatment, x-rays and other tests may then be done. Home care. As soon as possible, start sitting or walking again to avoid problems from prolonged bed rest, muscle weakness, worsening back stiffness and pain, blood clot in the legs. When in bed, try to find a position of comfort. A firm mattress is best. Try lying on your back with pillows under your knees. You can also try lying on your side with your knees bent up towards your chest and a pillow between your knees. Avoid prolonged sitting, long car rides, or travel that puts more stress on the lower back than standing or walking. During the first 24 to 72 hours after an injury or flare-up, apply an ice pack to the painful area for 20 minutes. Then remove it for 20 minutes. Do this after a period of 60 to 90 minutes or several times a day. This will reduce swelling and pain. Always wrap ice packs in a thin towel. You can start with ice, then switch to heat. Heat, hot shower, hot bath, or heating pad reduces pain and works well for muscle spasms. Apply heat to the painful area for 20 minutes, then remove it for 20 minutes. Do this over a period of 60 to 90 minutes or several times a day. Again, they show a picture of a person's back and how they're supposed to look on that. Do not sleep on a heating pad, as it can burn or damage your skin. Alternate ice and heat therapies. Be aware of safe lifting methods and do not lift anything over 15 pounds until all the pain is gone. Gentle stretching will help your back heal faster. Do this simple routine 2 to 3 times a day until your back is feeling better. Lie on your back with your knees bent and both feet on the ground. Slowly raise your left knee to your chest as you flatten your lower back against the floor. Hold for 20 to 30 seconds. Relax and repeat the exercise with your right knee. Do 2 to 3 of these exercises for each leg. Repeat hugging both knees to your chest at the same time. Do not bounce, but use a gentle pull. Medicines. Talk to your doctor before using medications, especially if you have other medical problems or are taking other medications. You may use acetaminophen or ibuprofen to control pain unless your healthcare provider prescribes another pain medication. If you have a chronic condition such as diabetes, liver or kidney disease, stomach ulcer, or gastrointestinal bleeding, or are taking blood thinners, talk to your healthcare provider before taking any medicines. Be careful if you are given prescription pain medication, narcotics, or medicines for muscle spasms. They can cause drowsiness, affect your coordination, reflexes, or judgment. Do not drive or operate heavy machinery when taking these medications. Take medicine only as prescribed by your healthcare provider. Follow-up care. Follow up with your doctor as advised. Physical therapy or further tests may be needed. If X-rays were taken, they may be reviewed by a radiologist. You will be notified of any new findings that may affect your care. Call 911. Seek emergency medical care if any of these occur. Trouble breathing, confusion, drowsiness or trouble awakening, fainting or loss of consciousness, rapid or very slow heart rate, loss of bowel or bladder control. When to seek medical advice. Call your health care provider right away if any of these occur. Pain becomes worse or spreads to your legs. Weakness or numbness in one or both legs. Numbness in the groin or genital area. Unexpected fever over 100.4 or Fahrenheit 38 degrees Celsius. Burning or pain when passing urine. Sciatica. Sciatica is a condition that causes pain in the lower back and down into the buttock, hip, and leg. Sometimes leg pain can happen without any back pain. Sciatica happens when a spinal nerve is irritated or has pressure put on it as comes out of the spinal canal in the lower back. This most often happens when a bulge or a rupture or a nearby spinal disc presses on the nerve. Sciatica can also be caused by a narrowing of the spinal canal, spinal stenosis, or spasms of the muscle in the buttocks that the sciatic nerve passes through. Piriform muscle. Sciatica is also called lumbar radiculopathy. Sciatica may begin after a sudden twisting or bending force, such as in a car accident, or it can happen after a simple awkward moment. In either case, muscle spasms often also happens. Muscle spasms make the pain worse. A healthcare provider makes a diagnosis of sciatica from your symptoms in a physical exam, unless you had an injury from a car accident or fall. You usually won't have x-rays taken at this time. This is because the nerves and disc in your back can't be seen on an x-ray. If the provider sees signs of a compressed nerve, you will need to schedule an MRI scan as an outpatient. Signs of a compressed nerve include loss of strength in the leg, which I have that, my left leg. Most sciatica gets better with medicine, exercise, and physical therapy. If your symptoms continue after at least 3 months of medical treatment, you may need surgery. Home care. Follow these tips when caring for yourself at home. You may need to stay in bed the first few days, but as soon as possible begin sitting or walking. This will help you avoid problems that come from staying in bed for long periods. When in bed, try to find a position that is comfortable. A firm mattress is best. Try lying flat on your back with pillows under your knees. You can also try lying on your side with your knees bent towards your chest and a pillow between your knees. Avoid sitting for long periods. This puts more stress on your lower back than standing or walking. Use heat from a hot shower, hot tub, a heating pad, or to help ease your pain. Massage can also help. You can also try using an ice pack. You can make your own ice pack by cutting ice cubes, in a plastic bag. Wrap the bag in a thin towel. Try both heat and cold to see which works best. Use the method that feels best for 20 minutes several times a day. You may use acetaminophen or ibuprofen to ease pain unless another pain medication was prescribed. Now, if you have chronic liver or kidney disease, talk to your physician, to your healthcare provider before taking these medicines. Also, talk with your provider if you had a stomach ulcer or GI bleeding. Use safe lifting methods. Don't lift anything heavier than 15 pounds until all the pain is gone. Follow-up care. Follow up with your healthcare provider if your symptoms don't start to get better after 1 week. You may need physical therapy or additional tests. If x-rays were taken, they will be looked at by a radiologist. You will be told of any new findings that may affect your care. When seeking medical advice, call your healthcare provider right away if any of these occur. Pain gets worse even after taking prescribed medication. Weakness or numbness in one or both legs or hip. Numbness in your groin or genital area. You can't control your bowel or bladder. Fever, redness or swelling over your back or spine. Alright. And this here is just proof I was in the hospital. Here's my vital signs. Temperature was 36.9 Celsius. Pulse was 97. Respiration 18. Blood pressure 194/87. Pulse ox 98. And that's from Candler Hospital here in Savannah. Now I went to Memorial twice. And reason is, first they treated me for the neck pain, and then they treated me for ankle pain, but not the back pain. Alright. Now, first they wanted me to take a prescription of diazepam or Valium, 5 milligram tablets. They wanted me to take it by mouth every 12 hours for anxiety. But they only wanted to give me 5 tablets with 0 refills. Now this is Memorial Health System. The other hospital I sometimes go to. May 23rd, 2017. Patient Shane Edward Lee. Date of birth 11/3/1969. Date of visit 5/23/2017. To whom it may concern, Shane was seen and treated in our emergency care department on 5/23/2017. He may return to work on 5/25/17. If you have any questions or concerns, please don't hesitate to call. Sincerely, Emergency Room MD. Now they give Memorial University Medical Center Emergency Department, 4700 Waters Avenue, Savannah, Georgia 31403. Phone number 912-350-8113. You were seen by Shale Jared B. MD. Diagnosis this visit: cervical GIA, left ankle pain. You are allergic to the following: no active allergies. Emergency department visit. Please note the examination and treatment that you have received in the emergency department has been rendered on an emergency basis only and are not intended to be a substitute for or an effort to provide complete medical service. A follow-up doctor or facility is named below. It is important that you be checked again as recommended below and report any new or remaining problems at that time. Because it is impossible to recognize and treat all elements of injury or illness in a single emergency department visit. In addition, if an x-ray has been taken, here it has been read on a preliminary basis only, and a final review will be made by the radiologist. We ask that you follow up with your primary care provider if this ER visit was related to a chronic health issue. Your primary care provider is listed as no primary care provider on file. It is your responsibility to follow up on your visit to the emergency department, so please call to arrange an appointment to see the following physicians for follow-up care. If you received HIV testing and wish to discuss your results, please call 912-350-0604. Please check with your insurance provider to verify this referral physician is in your network coverage. Medication. Based on the information you provided to us, as well as any changes during the visit, the following is your updated medication list. Compare this with your prescription bottles at home. If any questions are concerned, contact your primary care physician's office. They mentioned the diazepam, the Valium, as 5 milligram tablets, and it's commonly known as Valium, and to be taken every 12 hours for anxiety. Then aspirin, 325 milligrams EC tablet. Then Cardavalol, 12.5 milligram tablets, commonly known as Coreg. Gabapentin, 300 milligram capsules, commonly known as Neurontin. Lisinopril, 20 milligram tablets, commonly known as Prednizone, Fastric, Simvastatin 20 milligram tablets, commonly known as Vocor. Where to get your medications? You can best get these medications from any pharmacy. Bring a paper prescription for each of these medications. Diazepam 5 milligram tablets. Discharge instructions. A full comprehension exam was performed, including screening for emergency conditions, treatment, and stabilizations. I have done my best to address all your medical concerns and medical issues today. However, medical conditions evolve with time. Therefore, reevaluation with your primary care provider or the physician I refer you to is critical within 24 hours. Also, please be aware that sometimes symptoms worsen and conditions change. Therefore, it is very important to return to this emergency department immediately with any new or worsening symptoms, including but not limited to new or worsening fevers, new or worsening pain, numbness or weakness in any body part, difficulty speaking or walking, chest pain, shortness of breath, abdominal pain, difficulties with your bowel movements or urination, or any other new or concerning symptoms. Follow-up information. Follow up with Nurse 1. Specialty Nurse 1. Contact information 4700 Waters Avenue, Savannah, Georgia 31404 912-350-9355. When you call for an appointment, say that you are referred from this emergency department. Please note, if you have been referred to a specialist and you are on an insurance plan that requires pre-authorization in order to see a specialist, you must obtain pre-authorization. From your primary care physician. It is your responsibility to contact your primary care physician to obtain this pre-authorization unless you are specifically instructed otherwise. If you have a medical question or concern, please call Nurse 1 at 912-350-0282 or 855-553-2186. Should your condition worsen, do not hesitate to go to the nearest emergency department. MyChart activation. Please follow the instructions below to securely access your online medical records. You will be able to access information on this visit. If your primary care physician participates in MyChart, you will be able to send a message to your doctor, view your test results, renew your prescriptions, schedule appointments, and more. How do I sign up? In your internet browser, go to https://mychart.memorialhealth.com. Click on the Sign Up Now link in the new user box. You will see the new member sign up page. Enter your MyChart access code exactly as it appears below. You will not need to use this code after you've completed the sign up process. If you do not sign up before the expiration date, you must request a new code. MyChart access code 6X7X-5PDN3-Z57GN expires 7/22/2017 at 11:05 a.m. Please log in to MyChart before the expiration date. Then enter your social, birth date, and submit. You will be taken to the next sign-in page. Create a chart ID. This will be your main MyChart ID login ID and cannot be changed, so think of one that is secure and easy to remember. Create a MyChart password. You can change your password at any time. Enter your password, reset question and answer. This can be used at a time if you forget your password. Enter your email address. You will receive an email notification when new information is available in MyChart. Click sign up. You can now view your medical record. Additional information. If you forget your MyChart user ID password, please follow the prompts on the website to retrieve them. Remember, MyChart is not to be used for urgent needs. If you have an immediate medical question or concern, please contact your primary care physician's office or Nurse 1 at 912-350-0282. For medical emergencies, dial 911. Don't forget to download the MyChart mobile app on iTunes or the Android Marketplace. Neck pain care instructions. Your care instructions. You can have neck pain anywhere from the bottom of your head to the top of your shoulders. It can spread to the upper back or arms. Injuries, painting the ceiling, sleeping with your neck twisted, staying in one position for too long, and many other activities can cause neck pain. Most neck pain gets better with home care. Your doctor may recommend medicine to relieve pain or relax your muscles. He or she may suggest exercise and physical therapy to increase flexibility and relieve stress. You may need to wear a special cervical collar to support your neck for a day or two. Follow-up care is a key part of your treatment and safety. Be sure to make and go to all appointments and call your doctor if you are having problems. It's also a good idea to know your test results and keep a list of the medicine you take. How can you care for yourself at home? Try using a heating pad on a low or medium setting for 15 to 20 minutes every day, 2 or 3 hours. Try a warm shower in place of one session with the heating pad. You can also try an ice pack for 10 to 15 minutes every 2 to 3 hours. Put a thin cloth between the ice and your skin. Take pain medicines exactly as directed. If the doctor gave you a prescription medicine for pain, take it as prescribed. If you are not taking the prescription pain medicine, ask your doctor if you can take an over-the-counter medicine. If your doctor recommends a cervical collar, wear it exactly as directed. When should you call for help? Call your doctor now or seek immediate medical care if you have a new or worsening numbness in your arms, buttocks, or legs. You have a new or worsening weakness in your arms or legs. This could make it hard to stand up. You lose control of your bladder or bowels. Watch closely for changes in your health, and be sure to contact your doctor if your neck pain is getting worse, you are not getting better after 1 week, you do not get any better as expected. Where can you learn more? Go to the Search Health Library box on MyChart, https://mychart.memorialhealth.com and enter V723 in the search box to learn more about neck pain care instructions. not on my chart, go to https://mychart.memorialhealth.com and click the sign up now link to request an activation code. Current as of May 23rd, 2016. Contact version 11.1. So again, proof I have pain. Now here's my new medications. The hydrocodone and the prednisone. So yeah. Now this one here they prescribe ibuprofen, Advil, or Motrin, 600 milligram tablets with 30 tablets. I wasn't able to refill this one yet. And again, another visit. You were seen by Layer Sanjay, MD. Follow up with Roy Baker, neurosurgeon, 912-355-1010. Left ankle sprain, lumbar strain, cervical strain, morbid obesity. You are allergic to the following note: allergies. Emergency department visit. Please note the examination and treatment that you have received in the emergency department has been rendered on an emergency basis only and are not intended to be a substitute for or an effort to provide complete medical service. A follow-up doctor or faculty is named below. It is important that you be checked again as recommended below and report any new or remaining problem at that time, because it is impossible to recognize and treat all elements of injury or illness in a single treatment department visit. In addition, if an X-ray has been taken here, it has been read on a preliminary basis only, and a final review will be made by the radiologist. Sorry, I'm having pain again right in the middle of the neck area. Right here. We ask that you follow up with your primary care provider if this ER visit was related to a chronic health issue. Your primary care provider is listed as no primary care provider on file. It is your responsibility to follow up on your visit to the emergency department, so call to arrange an appointment to see the following physician or follow-up care. If you received HIV testing and wish to discuss your results, please call 912-350-0604. Please check with your insurance provider to verify this referral physician is in your network coverage. Medications. Based on the information you provided to us, as well as any changes during this visit, the following is your updated medication list. Compare this with your prescription bottles at home. If you have any questions or concern, contact your primary care physician's office. Medications list. Start taking these medications. Ibuprofen, aspirin, carvedilol, diazepam, gabapentin, lisinopril, simvastatin, where to get your medication in the pharmacy, discharge instructions. The X-ray reads that I conveyed to you today was based on my interpretation. However, I'm not a radiologist, and the official radiologist read will be performed sometimes within the next 24 hours, and if there is any significant important discrepancy, we will call you at the number you provided. It is possible that subtle fractures, retaining foreign bodies, or abnormalities may be missed initially. However, once the radiologist has read the film, we will notify you of any abnormal findings that were not initially reported to you. It is responsibility to give us an accurate phone number where we can reach you when you check out of the ER today. A full comprehensive exam was performed, including screening for emergency conditions, treatment, and stabilizations. I have done my best to address all of your medical concerns and medical issues today. However, I only saw you in one snapshot in time. Therefore, reevaluation with your primary care provider or the physician I refer you to is critical within 24 hours. Also, please be aware that sometimes symptoms worsen and conditions change. Therefore, it is very important to return to this emergency department immediately with any news or worsening symptoms, including but not limited to new or worsening fevers, new or worsening pain, numbness or weakness in any body part, difficulty speaking or walking, chest pains, shortness of breath, abdominal pain, difficulty with your bowel movements or urination, or any other new symptoms, or any other new or concerning symptoms. Follow up with Memorial University Medical Center Emergency Department. Specialty Emergency Medicine. Why? As needed as symptoms worsen. Contact information 4700 Waters Avenue, Savannah, Georgia 31403. 912-350-81813. When you call for an appointment, say that you were referred from this emergency department. Please note, if you have been referred to a specialist and you are not on an insurance plan that requires pre-authorization in order to see a specialist, you must pre-authorize from your primary care physician. It is your responsibility to contact your primary care physician to obtain this pre-authorization unless you are specifically instructed otherwise. If you have a medical question or concern, please call Nurse 1 at 912-350-0282 or 855-553-2186. Should your condition worsen, do not hesitate to go to the nearest emergency department. And then it goes over the MyChart activation, the same access code, looks like, and all that. And then it talks about ankle sprain, which I don't have an ankle sprain. I had an ankle fracture with a grade 3 sprain on it of the Tylenol. So that's irrelevant. Then next, training carrots instructions. And that's for this one. And that's where I've been all day. Anyway. Alright, anyway, that's where I've been all day, and another long video for you to go through if you want to. If you don't, fine. I don't care. But anyway, y'all have a nice day. Talk to you later. Bye bye.